So our two biggest risk factors when we're doing a percutaneous lung biopsy is we're worried about dropping the lung, which in medical terms is called a pneumothorax, and we're also concerned about bleeding within the lung. And all that gets worse when you have a moving target. And when you have a moving target, what I mean is everyone's breathing in and breathing out. That's inspiration and expiration. And although you try to ask the patient to be as still as possible while you're sticking a needle into the lung, they can never be that still. And they can never time their own respirations. You may ask them every time, take the same breath in while I'm advancing a needle into your lung. No one can do it. And no one with underlying lung disease that smoked for 50 years can do it. So what they developed and why the breath hold device is so good is that it literally calibrates a patient's breath. The doctor and the patient calibrate the patient's breath so the patient is breathing at the same precise time every time you're advancing a needle in 1 centimeter at a time under very precise CAT scan guidance. What that does is when you're precise and the needle is going into the lung at the same point every breath, you're actually decreasing the rent or the tear in the surface of the lung. So you decrease your risk of introducing air into the chest, and you decrease the tissue trauma or the hemorrhage within the lung, which decreases both the bleeding within the lung tissue and the coughing up of blood we refer to as hemoptysis. This device is so good because it increases your precision while decreasing your pneumothorax rate, which is why it's such a novel device.